Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and in today's video I want to show you how to properly use a tennis elbow band. So it's very common that patients will come into the clinic that are being treated for lateral epicondylitis for their eval, and they maybe have been told to use one of these by their doctor or their physician's assistant, which is amazing. They can be generally helpful. Anecdotally, I personally used one of these when I was dealing with tennis elbow and I really liked it. But again, it really depends on the individual. Some people it works well for and others it doesn't. However, it is very common for people to be placing it on sort of incorrectly or not in quite the most effective position. So I want to share with you how to do that today. So without further ado, let's get into this video. First, I just want to briefly show you the anatomy of a tennis elbow band so that you can understand the components that you should look for. There are so many different options, brands. I don't typically recommend a specific brand. I found personally for me that the neoprene versions, this one is a Healy & Weber. Again, not sponsored. I don't, work for them. I'm not an affiliate for them or anything like that. It's just what I used when I had tennis elbow. I find that neoprene bands tend to be the most comfortable versus like a plastic or a Velcro strap. So this one I found to be very comfortable. It looks like a strap. And then there should be a component that has like a foam piece, a thicker piece in it that's a little bit, a little bit more firm or rigid. And that piece, it's nice if you can get one that sort of adjusts around your muscles so that you can adjust it to your size of arm. But that is sort of the anatomy that we're looking for. We want a tennis elbow band and we want a part of it that has a thicker foam piece that's going to act as our counterforce agent. So now I'm going to go over how to place the tennis elbow band correctly when you have outer elbow pain or tennis elbow or lateral epicondylitis. So the pain is going to be on the outer side of your elbow. So step one, you're going to, again, find that thick piece of foam. That part is going to go directly over our muscle wad. So next, you're going to locate your muscle wad. So if you look at the outer side of the elbow and then you come directly down from that, there's this group of muscles here. Let me just be able to get a little closer. So this is the outer side of the elbow, lateral epicondylitis or lateral epicondyle. This is the muscle wad that we're aiming for. Do you see how I can kind of like pick that wad of muscles up with my fingers on the upper side of my arm or the outer side of my arm? So that is really where we want to center that thick foam wad. We want it to sit sort of corralling those muscles or like a saddle of that muscle wad. So that's where we want it to sit. And then you also want to measure about 3 fingers width down from the lateral epicondyle or from the elbow crease, right? So put 3 of your fingers there. The band should sit right in this area. So I'm going to go ahead and place it on myself. So it should just slide right on, depending on what style you have, of course. They can all be a little different. And then again, I'm finding that little meaty wad of muscles that I can kind of lift up. So my little foam pad is right here, right on top of that. And then I'm going to look about 3 fingers width down from the lateral epicondyle, and that's right where my band should sit, is that 3rd finger width. I will give you a pro tip. With the strap that tightens it, if you put the band on with the strap tightening it towards the outside of your arm, it's going to be a lot easier for you to cinch it tight versus if you have it flipped around. Let me just show you what I mean. In this direction, right? So the strap is going to like kind of pull inwards. You can still do it, but often I find that the band will like slide when I'm doing that. So I do find it's easiest, just like a little pro tip, if you have the strap kind of facing outwards to be able to fasten it down. And that's what it should look like. So it's going to disperse or spread the forces going in through the extensor carpi radialis and brevis, the muscles that attach at the outer side of our elbow, at our lateral epicondyle. It's going to spread the forces that are going into your arm throughout the muscles in the forearm. So there's going to be less stress to those specific muscles that are dealing with a tendinopathy or an epicondylopathy, if you will. So this is kind of what the tennis elbow band should look like. And again, this can be helpful for some people and not for others. I would recommend trying it to see how it feels. If you notice that you're having numbness or tingling down the arm, or if it makes your symptoms worse, it may be that you are also dealing with radial nerve pathology, or that this is not going to be a helpful intervention for you. So I would definitely not use it in that case. But it could be worth trying during activities to help protect the tendon. It does not fix anything, but it can help support your recovery. So again, tennis elbow strap. Hope that video is helpful. I'm happy to answer questions in the comments below. If you enjoyed it, please give it a thumbs up, subscribe to the channel, and I will see you in the next one. Thank you for watching.